Good morning. My name is Gord Johns. I'm the federal NDP health critic, and I first want to begin by acknowledging that we are gathered on the unceded territory of the Algonquin Anishinaabe people, and to thank them for their stewardship of their lands. I also want to thank, starting with Linda Silas with the Canadian Federation of Nurses Union, Jason McLean and the Canadian Health Coalition, Chris Galloway and Friends of Medicare, and Siobhan Vipond and the Canadian Labour Congress, and all the frontline health workers and advocates that are joining us today here in Ottawa. Nurses, care workers, and patients are the heart of our public healthcare system. Your voices matter, and I'm proud to stand with you. Tommy Douglas taught us that healthcare should depend on need, not the size of your wallet. That is the promise of the Canada Health Act. It's a promise that Canadians still believe in, and one they expect governments to defend. And right now, that promise is under real pressure. Across the country, nurses are telling us the same story. Same shift, different province, short staffing, burnout, and rising violence at work. Too many are working overtime just to keep the system afloat. We know that nearly 1 in 3 nurses is considering leaving their job in the next year. This is not just a staffing issue, it's a national healthcare crisis. And instead of fixing those problems, what we're seeing in Alberta is a deliberate move towards a 2-tier privatized model that lets people jump the line if they can pay. This won't reduce wait times. Let me repeat that. This won't reduce wait times. It will drain staff from public hospitals, pull nurses and doctors into private clinics, and leave everyone else waiting longer. We can't let that happen, not in Alberta, not anywhere in Canada. Public health care is one of the things that defines us as a country. It's not a business opportunity. It's a shared commitment we make to each other. The federal government has a responsibility to enforce the Canada Health Act, strengthen public delivery, invest in safe staffing, and make sure federal dollars build capacity in the public healthcare system, not private profits. Canadians built Medicare together. And together with nurses, workers, and advocates leading the way, we're going to defend it for our children, for our seniors, and for every family who depends on it. Thank you. And now I'll turn it over to Jason McLean, the president of the Canadian Health Coalition. Jason.
Thank you very much, Gord. I really appreciate this. Bonjour and good morning. The Canadian Health Coalition represents over 3 million people. Membership includes frontline healthcare workers, researchers, and civil society groups. Founded in 1979 by Tommy Douglas to protect and advance universal public healthcare. And we represent the majority of Canadians who rely on the public healthcare system. I just want to speak to why I'm here today. We have over 200 lobbyists on the Hill today, meeting with over 100 parliamentarians. That would be MPs, that would be their staff, and that would also be senators. And they have a keen focus on the critical importance of the healthcare crisis that we're currently under. And this is all occurring during inflation and the attacks of the Trump administration. So the main issues that we'll be looking at today is cuts to healthcare funding and jobs. What's going on right now at Health Canada with the threat of cuts is a prime example. It's time for at this time, with people questioning what's going on in science, we need Health Canada to lead the way. And cutting back will not help that. We also want to uphold the Canada Health Act. It is the federal health minister's responsibility to uphold the act. In situations like what's happening in Bill 11 in Alberta is a prime example. This is an affront on the Canada Health Act, and our government has been silent about it. This isn't going to be solved by one party. This is going to take all the minds to come together, and the Canadian Health Coalition wants to participate in that. Also, we want to expand pharmacare. The long-promised National Universal Pharmacare program is stalled under the Carney government. We have 4 provinces who have a deal and multiple other provinces who are looking to get deals, but this government is dragging their feet. Also, we need support for healthcare workers. Only a few years ago, they were hailed as heroes, but no one has stepped up to save them. They are suffering from underfunding, being overworked, and working short. Healthcare workers are leaving, and we need a plan in place to retain, recruit new people into the workplace. Also, a problem that we would like to focus on is a lack of access to the health minister. The coalition is shocked that Minister Marjorie Michel's office has refused to meet with most civil society groups. Meanwhile, the Canadian Life and Health Insurance Association has lobbied officials at least 53 times since April 28th. Health Canada policymakers have met with the insurance industry, and the coalition views the refusal to meet as unfair and un-Canadian. We want to install a vision of Canada. Canada's more than just pipelines, logging, and mines. Canada Strong means healthy people receiving care when needed. Care should be provided regardless of location or ability to pay. So we have a call for federal action. The federal government must defend universal public health care now. In my closing message, we need to hear from Minister Marjorie Michel, and this government must enforce the Canada Health Act. The time to engage in a truly Canada-strong nation-building project, which is a universal, publicly funded, publicly delivered, single-payer healthcare system. And we're here willing to work for it. Thank you.
Thanks so much, Jason. Now I'd like to turn it over to Linda Silas from the Canadian Federation of Nurses Union. Linda.
Bonjour, everyone. I'm Linda Silas. The Canadian Federation of Nurses Union represents over 250,000 nurses from across this country. So on behalf of Canada's nurses, I'm here calling on every Canadian who believe in our Medicare system to stand up and say no to any attempts to privatize our healthcare system. We, as believers in our public healthcare system, call on the federal health minister, Marjorie Michel, to exercise full authority granted to her under the Canada Health Act to intervene and stop Alberta's Bill 11. Alberta's Bill 11 is the first step towards a system where access to care depends on your ability to pay, not medical need. This bill gives doctors the opportunity to charge patients directly for medically necessary services that have been covered by Medicare for more than 60 years. The system gives the wealthiest Canadian faster access to service and longer wait time for the rest of us. Canada is facing many healthcare crises. If you're a patient or a family member, you know that. But the solution is not an American model. The solution is not privatization. The solution is stable public investment, safe nurse-patient ratios, reinforcement of patient safety, and respect of healthcare workers. Nous, en tant que défendeurs de notre système de soins de santé publique, nous demandons à notre ministre fédérale de la Santé, Marjorie Michel, d'exercer le plein pouvoir qui lui est accordé en vertu de la loi canadienne sur la santé pour intervenir et stopper la loi 11 de l'Alberta. Le projet de la loi 11 de l'Alberta est la première étape vers un système où l'accès aux soins dépend de votre capacité de payer et non d'un besoin médical. Ce projet de loi donne aux médecins la possibilité de facturer directement aux patients les services médicaux nécessaires qui sont couverts publiquement depuis plus de 60 ans par notre système de soins de santé. Le système donne aux Canadiens les plus riches un accès plus rapide aux services de santé et les attentes beaucoup plus longues pour le reste des Canadiens et Canadiennes. Le Canada fait face à de nombreuses crises dans le domaine de la santé et nous le savons tous. Mais la solution n'est pas un modèle américain. La solution n'est pas la privatisation de nos services. La solution est un investissement stable, un investissement public et des ratios de dotation sécuritaire une sécurité renforcée pour nos patients et le respect des travailleurs-travailleuses de la santé. To conclude, the Canadian Federation of Nurses Union is launching today Nurses for Medicare, infirmières pour l'assurance de santé. Why are we launching this? We need the Canadian, we need every advocate to support and to put pressure on our federal health minister to stop all privatization initiatives. We need your help, and we need it now. Tomorrow will be too late. We will be losing our healthcare system. Merci beaucoup.
Thanks so much, Linda. I'd like to now turn it over to Chris Galloway and the Friends of Medicare.
Just gonna put the mic back together. Thanks, Gord. So as Gord said, I'm Chris Galloway, Executive Director of Friends of Medicare in Alberta. I just want to say I'm so pleased to be up here with national leaders who recognize the seriousness of the moment that we're in. You know, Bill 11 is an existential threat to Canadian Medicare, not just for Albertans, but for all Canadians. And we need to recognize that that threat is in front of us. It's bringing two-tier American-style healthcare to Alberta. It contravenes the Canada Health Act very clearly, but it's also, you know, undermining protections that our public health care has in trade agreements, opening the door to American health and insurance companies to set up markets in Canada. It's an extreme threat to our Canadian sovereignty and our Canadian Medicare, and we need to see a federal response. And that's why we're here in Ottawa today, along with the Canadian Health Coalition. There are 32 Albertans from 23 different constituencies meeting with senators and MPs from every party, saying we need to hear from you, we need you to speak up and to take action. That is why we're here on the Hill. Unfortunately, we're not seeing that action currently from our federal minister and from our federal government. There's some urgency here. And we've had some pushback while we've been here in Ottawa saying, why are you here? Why aren't you in Alberta? Healthcare is a provincial thing. And we want to remind people that Canadian Medicare has always been a partnership between the federal government and the provinces. Yes, provinces deliver healthcare to their residents, but the Canada Health Act is enforced and administered by the federal government, along with the federal health transfer, worth billions of dollars that go to provinces every single year to ensure Canadians have access to healthcare no matter where they live. There's clear federal responsibility here, and we do not accept arguments that try to distract from that in this moment. And I want to end by thanking Gord for having us here. You know, the Friends of Medicare, for over 45 years, we've been proudly nonpartisan, and we've always been willing to work with politicians and governments who support protecting and strengthening public health care for all. We're always also happy to critique governments and politicians who aren't taking action to protect and strengthen public health care for all. When we saw Bill 11 tabled in Alberta, Gord Johns immediately spoke up in the House of Commons and in the media saying this clearly violates the Canada Health Act. Regardless of how Alberta implements it or regulates it, we need to see federal action. And we also saw Heather McPherson, the MP from Edmonton Strathcona, speak up loudly. But she is the only MP from Alberta who's spoken up on this. We think that's unacceptable. All of our MPs from Alberta should be speaking about this, and our federal health minister absolutely should be speaking about this. It has been months since this legislation passed. To say we're looking into it is not good enough. So that's why we're here on the Hill today. That's why we'll be rallying today, and that's why we're standing up here doing media today. So thank you.
Thanks so much, Chris. And now I'd like to turn it over to Siobhan Vipon from the Canadian Labour Congress. Siobhan.
Good morning, merci, and thank you. As you've heard from everyone, this is not a drill. Bill 11 risks damaging our public healthcare system, not just in Alberta, but across the country. Workers and their families are counting on us to defend public healthcare because it's not just about protecting a system, it's protecting what Canadians have built together and are really proud of. Our public healthcare system is something people around the world aspire to, and it reflects our shared beliefs that care should be there when and where you need it. In Canada, we care for each other. I'm a proud Albertan, but right now, the Alberta government is moving in a direction that attacks workers' rights, human rights, and the values that ensure that no one is left behind. In Canada, healthcare was built on a simple promise. You get care when and where you need it. And Bill 11 threatens that in its very promise. People are already struggling, and the last thing we need is a system that puts profit before people. Bill 11 moves Alberta towards this two-tier health system by allowing doctors to work in both the public and private pay system. And if that happens in Alberta, others will follow. And this is just another step towards privatization that pulls workers and resources out of the public system. Because every dollar spent in the private system is stealing it from the public. Now, as you heard from Linda and others, our healthcare workers want to care for patients, not be pushed into a two-tier system that puts profit before people. And this is not a new fight, because we are not going to back down. We know what happens when profit enters healthcare. The costs go up, access becomes unequal, wait times in the public system grow, and privatization will only work for those who can afford it. What's at stake is significant. Bill 11 opens the door to private for-profit hospital corporations, allows private companies to sell insurance for basic health care, and creates opportunities for outside investors to profit from Canada's health system. This is undermining the principles of the Canada Health Act, that care is universal, it's accessible, and it's publicly funded. So today we are calling for urgent action. Protect and strengthen public health care, invest in the workforce, infrastructure and capacity, and reduce the waiting times by expanding. Let's listen and support healthcare workers so that they can do what they do best, which is to care for Canadians. Because healthcare is about dignity, it's about fairness, and it is about respect. It's about, Canada. It's what makes us who we are. And, we want to look out for each other, and this is fundamental to that. So if we continue to allow privatization in our healthcare to grow, inequality will only grow bigger. So a strong healthcare system must protect everyone. Public healthcare is one of Canada's proudest achievements. So we must protect it, strengthen it, and keep it public. Thank you.
Thank you. We'll go to questions.
No
Okay.
questions. We'll take questions if you got them in our comment area. And we thank you for taking your time to be here. Don't forget to like, subscribe, and follow. We'll be back.